Have y'all seen this? I think this is a topic that you all might want to hear. Welcome to She Knows DNA. My name is Miavana and I'm a board certified genetic counselor. This video is dedicated to Sister Robin Jones. I love you and miss you dearly. Have you all heard of the genetic condition named sickle cell disease? Don't worry, I got you. Let's get into it. First, let's set the foundation. Red blood cells are in charge of sending oxygen throughout our body. A component of red blood cells is called hemoglobin, and even a component of hemoglobin is iron. So there are a number of ways as to how genes can affect the function of those red blood cells. Abnormalities in these genes can affect quantity, and they also can affect quality of the red blood cells. Those that affect quantity, so the number of red blood cells, the number of hemoglobins that is in the body, we call those thalassemia. Then there are those that affect the quality, just like in the condition that we will discuss today, sickle cell disease. Sickle cell disease is caused by a spelling change or mutation in the gene called HBB. All of us have 2 copies of the HBB gene because we have 2 copies of chromosome 11 in our body. When it comes to sickle cell disease, both copies of that HBB gene have to have a specific spelling mutation in order to be manifesting symptoms of sickle cell disease. Those that have that same mutation just on 1 copy of their HBB gene are considered to have sickle cell trait. So they are a carrier for sickle cell disease. What this specific spelling change in the HBB gene does is it causes the red blood cells to turn into the sickled shape. Those sickle-shaped red blood cells can get stuck in the body, which can cause some major damage. So now by having those sickle-shaped red blood cells, really you can imagine that it affects almost every part of the body. There's also something called going into crisis. So that's either whenever the red blood cells are literally being stuck in the red blood vessels, or if there is exposure and triggers to like dehydration, abnormal oxygen levels, especially like if you go hiking. And this is where you'll see symptoms of severe pain, organ damage, organ failure, and even a stroke. Without treatment, then the life expectancy for people that are affected with sickle cell disease averages about 52 years old, give or take. For those that are carriers or have sickle cell trait, you shouldn't have any symptoms. Now, there are rare occasions to where there are people that are trait that have gone into crisis, but like I stated, it is rare, but this is something that you need to speak with your doctor about. Now, there are a number of genetic conditions that have a higher prevalence in certain ethnicities or races. So Black people, or those that are of African descent, have a 1 in 12 chance of being sickle cell traits. Because of that statistic alone, some people think of it as the Black genetic condition. But I do want to make clear that Black people are not the only ones that have sickle cell disease or sickle cell trait. It can happen in anyone. One of the reasons, though, that we talk about sickle cell trait, and even those of African descent is because of malaria. In Africa, for instance, malaria runs rapid throughout that whole continent. Those with sickle cell traits have a built-in protection against malaria. It has something to do with how the parasite is not able to truly attack the body. So really, it was a survival of the fittest type of ordeal. So that is why in continents like Africa, there's a whole lot of people there that have sickle cell trait, but it's a way to protect them. That also means that the body, or really the genes, adapted to its environment in order to protect those persons that live in malaria-infested places. Doesn't this sound like epigenetics to you? If you don't know what I'm talking about, go watch one of my last videos. All right, now let's talk about treatments. Now there has been a cure found. This is through gene therapy, or more specifically gene editing, to where there's something called CRISPR that is literally correcting that spelling change in the body that is causing sickle cell. Now, the gene that is fixed is able to produce normal red blood cells, thus causing a person not to have any of those features or those pain and those crises from sickle cell disease. Y'all, this is amazing. It's groundbreaking and it's FDA approved. The issue is that it's not really accessible right now. It can cost millions of dollars in order for a person to get this one-time treatment. Now, yes, there have been some Black people that have gone ahead with the therapy and it has changed their lives. But there are other Black people that are a little bit hesitant, especially because of the history between Black people and the medical field. I know we already talked about Henrietta Lacks on this platform, and we all know what happened at Tuskegee. Another layer to this condition is how specifically Black people are treated whenever they seek help while they're in crisis. When a patient is in crisis, they usually go to the emergency room asking for relief and help. The thing is, the hospitalists don't take their concerns seriously. They may be waiting hours and hours out in the waiting room as other people go in before them. A lot of times these patients are labeled as drug seekers. So they're coming in, they're in excruciating pain, and they just keep asking for pain meds. But yet they're not believed, they're not taken seriously. If you don't believe me, look it up. So with all that being said, here's my advice. If you plan on having children one day, I would suggest getting something called carrier screening, and more specifically, make sure that they are looking at the HBB gene to see if you are a carrier or have trait for sickle cell. If you do have sickle cell trait, make sure that your partner gets tested too, because in these cases to where a person has sickle cell disease, it's because both of their parents had sickle cell traits. There's also the newborn screening, which is in every state in the United States of America, to where they are testing the babies as soon as they're born to be screened for a number of genetic conditions. That does usually include sickle cell disease. I know that's true here in Texas, and it is also true in Oklahoma. For all of those sickle cell warriors out there, please know that you are seen, especially by myself, who is a provider. And please continue to advocate for yourself. Spread the word, share your stories, because something has to change, and it shouldn't be your responsibility when we have all these people with degrees that know the ins and outs of this disease, but yet have still failed you. Now to leave you with words of wisdom. In honor of my big mama's heavenly birthday on March the 13th, Merry Christmas, no need to hurry. Mia Vane, I should start calling you Mia Vane, because that's not right that one of your cousins calls you that, but I'm your grandmother. I should be able to call you Mia Vane. Mind you, she knows my name is not Mia Vane. I'm gonna let that sizzle in your spirit, because baby, I know she would be cracking up. Listen, y'all, I did make a video doing my outro, but then I deleted it. And so, you just go hear my voice. How about that? Thank y'all for watching my videos. Feel free to like, comment, subscribe, and all the things. And I'll see you next time. God bless you. Bye.